Hi, my name's Frances Murray. I'm one of a team of 4 or 5 nurses who work within the urology theatre. When you come to theatre, the process is that one of our orderlies will be sent to the ward and he will escort you and one of the theatre nurses down to the interchange area where you will be met by a theatre nurse. This nurse will then introduce herself and will do all the necessary checks that need to be done. This may sometimes appear a bit repetitive, but they are necessary checks for us. You will then be transferred either on your bed into the operating theatre or onto a theatre trolley and into the anaesthetic room. We will all do our best to keep you at ease and hope you do not feel intimidated by the equipment and the people that are around. The first thing that we will do is pop on some necessary monitoring to record your heartbeat and your blood pressure. Then the anaesthetist will pop a small cannula into one of your veins. If you're having major surgery, it may have been recommended that you get an epidural anaesthetic along with your general anaesthetic. To have this done, you need to get a small catheter placed into your back. This will be done before you go off to sleep and will remain in place for the first few days post-operatively. After this has been done, you will be then put off to sleep. The first thing that will happen is that we'll ask you to breathe some oxygen via a clear mask. Then the anaesthetist will inject some drugs via your cannula and you will go off to sleep. We need to pop a small tube into your throat and this will be used to assist your breathing along with a machine throughout your surgery. If you're having major surgery or have some other illnesses that may require extra monitoring, these lines will then be put in once you are asleep. We then transfer you into theatre and the team then put you into the necessary position for the surgeon to be able to carry out the surgery. Once your operation is finished, we will then transfer you back onto your bed and the anaesthetist will slowly waken you up and remove the tube from your throat. You may not be aware at this time that you are awake. The first that you may be aware is once you are in recovery room and you'll see other beds and nurses round about you.
My name is Dr. Kathleen Ferguson, and with Dr. Harvey, we are 2 consultant anaesthetists out of 51 in Aberdeen Royal Infirmary. The department has a total of 97 anaesthetists. We are the main teaching centre for the north of Scotland. The primary task of the anaesthetic department and the anaesthetists is to deliver safe and effective anaesthetic care to the population. In order to do this, we need to have several things in place. We need to know that the environment that we're working in has the appropriate facilities and equipment. We need to ensure that we have the knowledge and the skills appropriate to meet the task. And we need to know about you, the patient. We need to know about you because we have to provide for you an appropriate risk versus benefits analysis to help you make the decision about proceeding for surgery. Risks in anaesthesia and surgery come from several sources. They come from the surgery itself, they come from the anaesthetic itself. Although modern-day anaesthesia is very, very safe and the risk of serious adverse events is very rare. A very useful account of this can be found on the Royal College of Anaesthetists website in the patient section. Risks, more importantly, come from the stress that major surgery will place on the body systems like the heart and the lungs. The system reserve of the patient is very important as well. If we already have problems in organs like the heart and the lungs, then the stress of a major surgery can make these problems greater. What we're really wanting to know is, how fit are you? All this useful information is gathered at either the pre-assessment interview or on your admission to the ward. The junior doctors or the nurse at the clinic will take your history. We'll find out all about you, what you get up to, what you can manage. We will also examine you and we may add in additional investigations or tests to give us more information. Once this process is completed, then the patient, the anaesthetist and the surgeon, together as a team, will make the decision about the benefits of surgery outweighing the risks involved. It's from this point onward that your anaesthetist will meet with you and agree with you a tailored anaesthetic plan for your care.
Hello, my name is Dr. Harvey, and like my colleague Dr. Ferguson, I am one of the consultant anaesthetists that you may meet when you come in for your operation. Once it has been decided that you need an operation, it is important that you get the opportunity to meet with your anaesthetist. This may happen at the time when you come in for your operation, or if you've been pre-selected for pre-assessment, it may happen at an earlier time. When you meet with your anaesthetist, it is important that you will discuss and agree several factors relating to both the preoperative, intraoperative and postoperative period. There are certain things that you, the patient, can do in the period leading up to your operation that can have a positive effect on your anaesthetic. You can stop smoking, try to eat a healthy diet, and keep as active as you can. When you meet with your anaesthetist, there are certain areas that we would like to discuss. We will look at what medications you're taking and which ones need to be discontinued or continued. We will look at perioperative risk factors and look at ways of trying to reduce things such as blood clots and chest infections. We may talk about whether a sedative is required before you come down to theatre. One of the important aspects that we will discuss is what type of anaesthetic you will require for your operation. We will take into consideration your physical health and also your examination, plus previous experiences that you may have had during an anaesthetic. It may be that a general anaesthetic, where you are fully unconscious, will be the option. A regional anaesthetic, such as a spinal or epidural, might also be considered, where you have the option of being conscious and, if required, have some additional sedation. Other areas that will be discussed will be whether additional types of monitoring will be required. And also, if you do require a blood transfusion, what are your views on this? Another important area to discuss will be your pain relief after the operation. All the anaesthetists at Aberdeen Royal Infirmary follow the 3-step analgesic ladder principle laid out by the World Health Organization. This ensures that you will receive the appropriate level of pain relief relevant to your type of operation. If you are undergoing major surgery, it is very likely that you will meet with the hospital's acute pain team, who will review the type of pain relief that you require on a day-to-day basis. Again, if a major operation is planned, your anaesthetist may discuss with you and recommend a short stay post-operatively in either the high dependency unit or even in the intensive care unit. Whatever your reason for meeting with your anaesthetist, being it a big or small operation, it is our job to ensure that your safety is paramount and that your anaesthetic is as straightforward as it possibly can be.